Hello, Assalamu alaikum, and welcome to the Ruwa Shah show. You are listening and watching us on Salaamedia. It is 7th April, and it is the World Health Day is observed globally today. Now, we are living in a pandemic, and health workers, doctors, and nurses, and the other staff at the hospitals are on the front line of this war with the virus. To talk about the situation from Pakistan, we have with us Dr. Salman Shafi Koul. Thank you so much, Dr. Salman, for joining us. Yeah, could you brief us about the situation of health workers in Pakistan? How good or bad is it?
Well, it's too early, in fact, to say that how good or bad we are right now, because we are still in the beginning phases of the spread of the disease. We do have around 3,000 cases overall in the country, but they're all spread out in different regions. So I wouldn't say that the healthcare system is right now typically burdened, but we like the healthcare personnel do have an anxiety factor that yes, this could all explode in the next coming few days or weeks. So we have to be prepared, but not particularly burdened right now.
But there have been some protests by the doctors in Balochistan and Quetta area, and dozens of doctors have been arrested by the government of Pakistan for that. They were demanding just more protective suits or equipments required to stay safe.
As far as the equipment is concerned, yes, we do have some patchy areas where they have not reached in proper amounts. But overall, I think the government has done a good job in spreading out these PPEs all over the country. There are some areas where I think more equipment needs to be supplied and given, and Balochistan is one of those areas. And what I heard today in a report is that a lot of equipment has reached the areas where all this protests and this arrest took place. And now I think even those areas have now expressed that they have received adequate supplies. So I think it's pretty sure, being a third world country and in Southeast Asia, you can't expect everything to be like working like clockwork. But we are learning, and the government is learning to deal with one of its first pandemics, in fact. So there is a lot of things to learn from, but I'm pretty sure that the government has intent to be as efficient as possible, but there will be some things that will be missed.
Right, Dr. Salman, but there have been deaths of doctors reported by the COVID. At least 3 doctors have died in Pakistan, and hundreds of others have been tested positive. I'm talking about the health workers only. So they are really putting their lives at risks and are going out to work. So you yourself are a doctor. How do you protect yourself?
In my hospital, we do have adequate PPEs available. We have one area which has been isolated for the coronavirus patients who are stable and who require intensive care. So the whole of the area is located at one place. So so that area does receive adequate PPEs. We also initially had some anxiety in doctors that the whole hospital should get PPEs, but I think for everyone to wear PPEs, full body suits, is not the way forward. I think this misuse of PPEs should not take place. PPEs should be limited to areas where you have either COVID-19 positive patients or patients who really you do suspect are to be COVID-19. Not everybody that comes to the hospital has to wear a full body suit. So we have made a protocol in our hospital that which areas require only a face mask, a surgical face mask, which areas require an N95 mask, and which areas require a full body suit. So I think if that protocol is followed overall, we can save a lot of PPEs for the real work.
Right. There are also a lot of patients who require treatment in the intensive care units of hospitals. You know, the COVID patients who go into the phase where they are severely affected
Right.
and they need intensive care units. Do you think Pakistan, in hospitals in Pakistan, the system in place is enough to deal with the current percentage of those severe patients?
Um, uh, at the time right now, I think it's enough. But if we have a large surge of patients who require intensive care management and
Mhm.
treatment, we might be quite a bit short in ventilators. Although the government has tried to arrange some approximately 800 to 1,000 ventilators on an urgent basis. We are expecting some ventilators from China in the coming few days and weeks. So we might have a surge of 1,000 to 2,000 ventilators for Pakistan. But if we go the same route as Italy, Spain, or the United States of America, um, then I think not even 100,000 would be enough. But as the trend has been showing right now with the lockdown in place, things are not as bad. I can say it very confidently that what we were expecting over the last few weeks, things are not as bad as the things we see in Europe right now. As you saw that the deaths and
Number of
the new
cases,
patient
yeah. The surge,
uh,
the graph is going high at a very fast
yeah,
level, yeah.
the surge in the West and the surge here in Southeast Asia, there's a big difference,
Now,
and
a
people have
lot of
started talking.
theories are in place that say that because India, Pakistan, or Southeast Asia, uh,
Right.
there's not enough testing being done, and that is why the cases are not
Oh yes.
coming out. The real numbers are not
Oh yes.
coming out. How much do
But
you think it is true?
because we talk about this every day when we receive patients, and one thing I am very clear about is that right now no country in the world is doing 100% tests of their civilians, right?
Mhm.
So we have to know that there's always a hidden number of patients which is not tested. So the same goes in Pakistan. We have a very low amount of tests being done. So, but there's one thing that we need to. So, when you know that you're not testing your whole population, you don't know how many COVID positive patients are walking around in the streets with no symptoms, but they are spreading the virus.
Right.
So, a lockdown is the way to go. Number one. Number two is that these patients that you have not tested, they will come to the hospital once they have symptoms. So, living in a city like Islamabad, where I think the vast majority of the people are educated,
Hmm.
if we would have had symptoms, if we would have had patients becoming serious, if we would have had patients dying of COVID-19, we would be seeing them in our emergency departments, and we are not seeing that. So even though we do get positive patients, and we get patients of all ages, even young patients, middle-aged patients, elderly patients who are positive,
Hmm.
but we still don't see a surge of patients who are requiring extreme number of patients requiring intensive care management or admissions. So I think it's a blessing from God, because me being a doctor, I should come up with a scientific answer. But right
Right.
now, I have nothing but to say that this is a blessing from God, and the only thing left is to grab onto theories. Like you must have heard about theories about the BCG
Right. I
vaccine.
was going to ask about that. There are a lot of theories, and there is
Yes,
apparently
yes.
there's a research that says that because South Asian countries have taken the BCG or the tuberculosis
Mhm.
vaccination that we call as, so that is somehow protecting or sort of giving us immunity of being able to be protected from the virus.
Right.
And how true could it be scientifically?
Well, this thing can go anywhere. Like this is still a theory. There's a lot research needs to be done to come down to maybe a recommendation that really BCG does play a role.
Hmm.
But we also live in a very infested area of the world with malaria. Even a theory of malaria is going around these
Right.
days. So So a lot of countries have started testing or are intending to test drugs for malaria that work against the virus as well, the COVID-19 virus. And people have also, specifically, I heard a few days ago that Germany has even maybe started trials on the BCG vaccine early on. Because what a recent paper out of Australia that I read a few days ago was that it's very, very clear that countries who do not use the BCG vaccine have been the most affected, and the countries who started to use the BCG vaccine later on are also affected. And the countries who have been using the BCG from a long time, for example, Pakistan, India, and Bangladesh, they are the least affected. So yes, theories, but they do hold some weight.
But
So
there's a contradiction because there are a lot of African countries where a countable number of cases have been diagnosed as of now. And there is also no use of BCG vaccination in many of those countries. I'm not saying the entire continent. And yet the cases are low. So, yeah, as you say, those are theories, but how
yeah,
could they be
so
tested?
there you can fit in the malaria theory. Like Africa is like us, infested
Mhm.
um, with malaria. So it's quite endemic there. So one of the two theories, or both of them, have some role to play. But still, I hope what I'm saying is right. But till now, we have been saved from that extreme surge that we saw in the West. I hope it's the weather. I hope it's the theories,
Mhm.
but something is working, and the most we can do right now is to enforce the lockdown that
And
the civilians
how
have.
effective is the lockdown in Pakistan, or are people staying inside?
Um, um, the lockdown here does vary from province to province. The Sindh province has forced a stricter lockdown,
Mhm.
whereas Punjab has been a bit softer on the lockdown, whereas the federal area, the capital where I live, has been a little more softer on the
Mhm.
lockdown. I do support the government stance on this. Is that
They
a
enforce
country
it.
like Pakistan, yeah,
Mhm.
like a country like Pakistan cannot have a total lockdown
Right.
because being a third world country, being in a country with a population a huge population is below the poverty line. I think you cannot lock the people inside their homes because they will literally die of hunger, if the lockdown goes on for a lot longer. So I think a soft lockdown, or maybe not a very strict lockdown, is the way forward. And I think it has been working for Pakistan over the last few weeks.
And as a doctor, you do not see that it will need to change. God forbid, so far you say the situation is under control. And what if there is a surge? Is Pakistan prepared to deal with, God
Um,
forbid, any surge in the cases?
the thing is that was America prepared? Was the West, was the Europe prepared?
Mhm.
In fact, they were not. And I think it's too late to prepare yourself completely. But I think it's not too late to equip yourself as much as you can. So if God forbid we do have a surge of the sort we saw in the West, there are going to be a lot of casualties. But I think we will put up a good fight and be prepared as much as we can,
Yes,
because
Dr.
being
Salman, you and your breed and your colleagues, they have been on the front line, and entire humanity is grateful to whatever doctors around the world are doing right now. Tell us
and we do
more
appreciate
about
that.
you, as you know, you yourself are going to the hospital. Do you have a family? You come back to home, and how do you quarantine yourself and or
Oh,
isolate yourself after that?
it's been a huge debate, in between us doctors, and also in between me and my family, that how I should enter the house. So being in contact with patients who are COVID positive, although I do wear a full body suit when I do their rounds, but the problem is that I have, like, what I did was I talked to a few colleagues outside Pakistan as well as to what they were doing in the West. I have kept a separate entrance into my home, and I change in a room which is only limited to me, and then I enter the house, and I try to wear my mask, at least the surgical mask, for as long as I can. But it's very difficult with the family and kids. So I try to keep my distance, but there's no 100% way of like enforcing that. The only way is like you leave the house and stay in a separate room, and I think that's the only way if that can be done.
Right, and
You
I hope
know,
your family is cooperating in that. I mean, you mentioned kids, and it must be very difficult.
yeah, they are starting to learn now that you have to stay away from they have to stay away from their father, but it is difficult, both for us for parents as well as kids. Like to understand what is going on right now.
Yeah, Dr. Salman, there are a lot of other diseases that Pakistan, countries like Pakistan are susceptible to, and usually the hospitals are very crowded. How are you dealing? How are the doctors in Pakistan dealing or separating patients, COVID patients, from the general
I,
patients?
I think that's a really good question because when they made the isolation ward for COVID-19 patients here in Islamabad, I think the first question that was raised in the media and also among doctors is that how are we going to manage that?
Hmm.
Because the hospitals are already so crowded, and the reports that came back from Italy was that a lot of patients who were COVID negative became COVID positive just because they were visiting in large numbers to the hospital for very small symptoms. Um, so in that thing, lockdown has helped a lot. The hospitals are basically empty from the patients who need not be in the hospital. So only the patients who are really sick do come these days. So we are lucky in the sense that lockdown has helped us in that. So when the hospitals do open, so what I have seen that many countries have done, and I want Pakistan to do the same, is to try and make these isolation centers a bit far away from the cities, or at least in the peripheries of the cities,
Hmm.
to keep the non-COVID positive or COVID suspected patients as far as away as possible.
Yeah, how many, you mentioned the isolation wards and new hospitals that will be particularly used for COVID-19, obviously. How many hospitals have
Hmm.
been constructed in the last few weeks in Pakistan?
I won't say I won't use the word constructed, but I think how many buildings
Have
have
been
been transformed. Yes,
transformed, right? Sorry.
yeah. So a lot of buildings all over Pakistan have been transformed into isolation wards, and a lot of hotels. There's a hotel just near my home that has been temporarily made into a quarantine center
Mhm.
for all the passengers who are arriving on the Islamabad airport. So they come straight to the hotel, and from there they are tested, quarantined, and sent out once their tests are negative.
Mhm.
So I think on this front, they really have done a lot. So I was not expecting that much to happen in just a few weeks, but they have done a lot. And plus, we didn't have a surge yet in Alhamdulillah of patients.
Mhm.
So it has given some time for the government to
Right.
really
Even according to
enforce and.
the, I was reading this WHO director's interview with the Time magazine, and he mentioned particularly about the Southeast Asian countries that they have the time to, prepare themselves,
Right.
which China probably didn't have, or even if they had, they did not utilize that time, or even the US did not have the time. The graph just got up suddenly. So, is that time being utilized properly?
Um, uh, I won't say it's being utilized properly because there is always a question of funds. Like we don't have unlimited funds to carry out dozens of projects at a time in a city. Like although they are doing their best, I don't have anything bad to say about what the authorities have done. They are trying their best, but we can't be 100% prepared. As I already said before, that we have a lot of things that restrict us, and finances being one of them. And plus, there's a global shortage of PPEs, as it's all
Right.
over the media. All the countries are fighting hard to get hold on to these equipments, but
Is there,
um,
Doctor, by any chance, an alternative of the PPE? I mean, I know that despite the use of, we were talking to a doctor from Kashmir before you, and he said that despite use of this protective gear, doctors contracted the virus. they were using those and they were taking all the measures,
Right.
they still contracted
No,
COVID.
I want like people to understand PPE is not something like it's going to protect you 100%. Like it might protect you, like it might avoid 80 to 90% of the exposure,
Mhm.
but you will get exposed about 5 to 10% of the times, like you are exposed to the virus. So there is some spillage or leakage that passes through your masks and through your suits as well. So it's not about that they will protect 100%, but you try to decrease your chances of being exposed and infected by the virus. Because all these masks, no matter how good they are, how well they have been prepared, they will always have leaks because everybody's face is different.
Mhm.
Everybody's how well they fit the contours of your face. It all depends on the mask itself and like the appearance of your face. Like I have never been satisfied 100% by the masks I use. There's always slight leaks, and when you walk into a ward that is full of coronavirus positive patients,
Right.
there's a lot you have to trust in God and just hope for the best that you don't get infected. You should take your full precautions, but in these times, I think you have to be a bit braver than normal.
Right, I'm sure the situation of all the workers who are at the front line, literally at the front line of the war with this pathogen that has, created a ruckus in the entire world. Also, Doctor, I'd like to ask you about the awareness among the Pakistani masses. There's a lot of percentage of population that are not literate, and at times there are clerics, religious clerics, who gave speeches that sort of denounced taking the measures. Like, there were a lot of speeches made. And is there a control on public gathering now, for example, in mosques or any
Uh,
other religious gatherings?
Yeah, I think it is. Yeah, you do have like a few incidents that took place last Friday. Uh, People did not people forced their ways into mosques. I think it happened in Lahore somewhere.
Mhm.
But overall, I would say I think 90 to 95%. I'm talking about cities. That
Mhm.
at least in the cities, it's being really enforced, and I think most of the clerics are on board right now, and the people are the internet revolution over the last 10 to 15, 20 years has played a big part, that people, although they do respect clerics, but the thing is that
They're more aware on their own.
they are aware of the dangers, and I think as adults, I think they can decide for themselves, and most of the people are staying away from gatherings.
Right.
It has
Before we wrap up tonight, one last question. Are doctors enough in Pakistan? Like, are there enough number of doctors in Pakistan to deal with any, God forbid, situation that will, land us in a trouble situation where we'll have a lot of patients? Because I sort of somebody told me that there are students who are in their final year of medical colleges. They are being asked to prepare themselves if there is a situation where they will have to attend the patients.
Right. Of course not. We are very much short of doctors. Whether there is a pandemic or not, we are very short of doctors. And even if they bring out all the students from the medical colleges all over the country, it's just going to add a few percent, to the numbers that we already have. It's not going to make a very big difference. And so this is something that cannot be changed overnight or in the coming weeks or months. So we have to do with what we have, and we are stuck with a low number of doctors, and we have to make them count, and like use them to their best ability to try and fight this.
Right. It was a pleasure talking to you, Dr. Salman Shafi, and we know that you took out this precious time of yours. I'm sure you are, you're there on guard, on duty, and I'm sure you're doing your best to treat those patients who are affected. And I really hope you're taking all the precautions to keep your family also safe. We
Thank you.
as humanity really congratulate and are really grateful to your service to all of us.
Thank you very much. Thank you very much.
Thank you so much for joining us tonight. Assalamu alaikum. And with that, we wrap our program tonight. We'll see you next Tuesday, 8 p.m. to 9 p.m. South African time. Till then, take care, be safe, and stay away from the virus. Assalamu alaikum.
Right.